Hey, it's Dr. Dunaway here with Chiro Strength, and today we're going to discuss a simple exercise to regain extension when you've been dealing with a neck issue. So this is going to be something that we use a towel for, and this is commonly one where if you lay at the edge of a bed, you can just kind of let the neck hang over like a towel like this. But to start with, we're going to use a towel or a jacket or something you can kind of wrap around the back of the neck like this. And what it should do is it should rest right above the big bone here in the back of the neck. And I'm trying to support the entire cervical spine here. So if your neck is very symptomatic and it hurts to look up even a little bit, you're just going to use a thicker towel. If you can get a little bit of movement and it just hurts as you get full range, you're going to use a smaller towel or a lesser diameter. So the more range you have, the smaller the towel, or the more movement that you start to get when using this. The progression to this is just a smaller and smaller diameter towel till eventually you're just kind of using the edge of the towel to target a specific segment. So what we're going to do here, paying attention to the pain or any type of symptoms you might have down the arm, we're trying to do as much as we can without provoking symptoms. So starting with the towel over the neck like this, you're going to start by opening up the chest, and if it helps to kind of lean on the back of a chair just to get that thoracic spine slightly extended. I don't want you doing this exercise in a slouch position. So I'm going to hold the towel here upright with my chest, holding a little tension on the base of my neck here, just kind of not forcing the towel down, but letting the weight of my arms hold this towel into the back of my neck. I'm going to slowly retract over slightly and then let my chin slowly come up. Rest, breathe, and then slowly come back down and relax. And just continue to do repetitions. Try to do 8 to 10 slow reps, making sure you're not forcing it. And the trick to this is the very first movement is a chin retraction back and then my neck comes up. I'm not going to get a whole lot of extension in this lower cervical spine if I just use my occiput. And if I just do this, I'm not going to get much extension in that lower cervical spine. So I'm trying to kind of drape the lower cervical spine over that towel first before I let the upper cervical spine extend, so we get a shared distribution of that extension. Now, if I start to do a thinner diameter, I'm going to go to the segment. If I push into a segment like this and it's painful, I'm either going to go directly below that segment and try to do the same thing, or slightly above that segment. And now if I'm higher up in the cervical spine, because that curve goes like this, if I'm higher up in the cervical spine, I might not be holding down like this. I might be holding straight ahead and just trying to kind of extend the segments right above the most painful segment over this towel. So the more focused you get, there is a little bit of change in where your hands are going to be at. So the lower the cervical spine, you're kind of holding down at an angle like this. Mid cervical spine, you're kind of holding straight ahead. And if you did have something higher up, most cervical disc injuries or most cervical injuries are going to be like C5, C6, C7. So very rarely are you going to be up here in the cervical spine doing something like this. But especially just right above C5, C6, if you're kind of in this position, you might just kind of be trying to get a little movement above that segment or movement below that segment. But starting off with a thick towel, slowly get less and less diameter to where you get a little bit more of like a knife edge, if you will, of the towel. And you're trying to get 8 to 10 reps, ideally a couple times a day, to desensitize that movement of the neck. So if you can look up with full range of motion and you're not getting any symptoms down the arm or any pinching of the neck, that's a good sign that this is improving. So you're just going to continue to use this little by little, only working through the pain-free ranges or the symptom-free ranges of motion. And you should notice little by little you get more extension in the neck.